So good morning. Okay. So good morning to all of you. Okay. So good morning to all of you. High yield MCQs for all of you. I'm Dr. Pradeep Pawar with 21 years of experience in teaching anatomy for the undergrad and the postgraduates. Entrances all over India and abroad. Okay, we start with the first MCQ. Have a look at this and answer. Read the MCQ, answer it, then we discuss. Yes. Anyone? Okay, we'll start. A 62 years old man with long history of duodenal ulcer. Long history of duodenal ulcer. Okay, students, the moment this duodenal ulcer comes to your mind, where is this duodenal ulcer located? In which part of the duodenum are these duodenal ulcers very common? Which part? First part of the duodenum. They are very common in the first part of the duodenum. Now, which wall? In the first part, which wall? It's on the posterior wall. So one thing we know, first part of the duodenum में ulcers होते हैं. They are very common on the posterior wall of the first part of the duodenum, right? So a 62 years old man with long history of duodenal ulcer was seen in the emergency department after vomiting blood, stained fluid and exhibiting all signs and symptoms of hypovolemic shock. The following statements were correct except: a duodenal ulcer is most likely to be situated on the posterior wall of the first part of the duodenum. Correct? Yes, that's correct. So duodenal ulcer is very common in the first part on the posterior wall. Correct. The gastroduodenal artery is a small branch of hepatic artery. क्या बोलते हैं? What do you say, students? Yes. So option A is correct. Emmanuel. Okay. So option B, the gastroduodenal artery is a small branch of hepatic artery. That's wrong. That's wrong. Gastroduodenal artery is a branch of what? Anyone? Gastroduodenal artery is not a branch of hepatic artery. We'll come to this. Option C, gastroduodenal artery lies behind the first part of the duodenum and was probably eroded by the ulcer. Yes. So posterior relations of the first part of the duodenum is gastroduodenal artery. We'll come to this. Hemorrhage from the duodenal ulcer often reveals itself by passage of black stools on defecation. Yes, so because of that ulcer, black stools on defecation. Clear. So have a look at this. I'll just start with this. Tell me, students, celiac trunk. What are the branches of celiac trunk? One moment, I'll just remove this charger. Okay, what are the three main branches of celiac trunk? Can anyone answer this? The three main branches of celiac trunk, one is the left gastric, splenic, and the third one is common hepatic artery. The left gastric, the splenic, the common hepatic artery. The common hepatic gives further three branches. One is the right gastric, gastroduodenal, and the common hepatic. It's a common hepatic, so it gives one, the right gastric, second is the gastroduodenal, and the third artery goes to the liver, and this is what we call as the hepatic artery proper. Clear? So common hepatic artery के तीन branches, the right gastric, the gastroduodenal and the hepatic artery proper. The gastroduodenal further gives two branches. One is the right gastroepiploic and the other one is the superior pancreatico-duodenal. Superior pancreatico-duodenal, correct. So gastroduodenal artery is not a branch of hepatic artery. This gastroduodenal artery is a branch of common hepatic artery. Common hepatic artery. The gastroduodenal artery is a branch of common hepatic artery. Is this clear? Okay, one more thing. Have a look. Now, students, if you can tell me, this is the first part of the duodenum, that's the second part of the duodenum, and that's the third part of the duodenum. Okay, that's the third part of the duodenum. Now, behind the first part of the duodenum, can anyone answer this? What are the relations, posterior relations of the first part of the duodenum? Yes, students, posterior relations of the first part of the duodenum. Anyone? Can you answer this? You answer, students, come on. Posterior relations of the first part of the duodenum is one, the portal vein. सबसे पीछे होता है portal vein. To the right of the portal vein, is the bile duct. To the right of the portal vein is the bile duct, and to the left of the portal vein is hepatic artery. To the left of the portal vein is the hepatic artery. So, the retroduodenal part or the first part of the duodenum के posterior relation क्या होते हैं? First part of the duodenum, posteriorly it's related to the gastroduodenal artery. This is the gastroduodenal, not the hepatic. This is the gastroduodenal artery, the portal vein and the bile duct. Okay, these are the posterior relations of the first part of the duodenum. The portal vein, the gastroduodenal artery is on the left side and the bile duct is on the right side. So, ulcers are very common in the first part of the duodenum. On which wall? The posterior wall. And if there's an ulcer in the posterior wall, if it gets eroded, if it is eroding, which artery behind? That's the gastroduodenal artery. I hope this is clear to all of you. Okay, it erodes the gastroduodenal artery. So that's about the first MCQ. Just have a look at this once again. See the MCQ once again. Look at this. I'll erase the ink. So 62 years old man with long history of duodenal ulcer was seen in the emergency department after vomiting bloodstream fluid and exhibiting all signs and symptoms of hypovolemic shock. The following symptoms are correct except the duodenal ulcer is most likely to be situated on the posterior wall. Yes, that's right. The gastroduodenal artery is a small branch of hepatic artery. That's wrong. So gastroduodenal artery is a branch of common hepatic artery. Common hepatic. The gastroduodenal artery lies behind the first part of the duodenum. Perfect. And was probably eroded by the ulcer. That's correct. Hemorrhage from the duodenal ulcer often reveals itself by passage of black stools on defecation. That's right. Clear to all of you, students? So remember, सबसे पीछे portal vein होता है. The most posterior is the portal vein. On the right of the portal vein is the bile duct. On the left of the portal vein is the gastroduodenal artery, and these three structures are related behind the first part of duodenum, posterior to the first part of the duodenum. Okay, coming to the next MCQ. Yes, if you can answer this. These are all representative MCQ from the respective topics, so you should know this. Answer this. Have a look at this, go through it. Anyone? Answer this. Come on, students, come on. Let it be an interactive session. You answer. So then we discuss the MCQs. You keep on answering. Let it be an interactive session. Okay, here I start. A 20 years old male was involved in a fight. Fine. During the fight, he received a deep knife wound in front of his right thigh. So there was a stab in front of his right thigh. On examination, it was inferred that the knife point had severed the trunk of the right femoral nerve just below the inguinal ligament. That is, the femoral nerve is injured below the inguinal ligament. All the following signs and symptoms are true except. Now students, before we come to the options, let me tell you something about the femoral nerve. Femoral nerve is a branch of, can anyone answer this? Femoral nerve is a branch of what? Femoral nerve. Just some important things about the femoral nerve. Femoral nerve is a branch of lumbar plexus. It's a branch of lumbar plexus. It is, what is the root value of femoral nerve? It is formed by the dorsal divisions of ventral rami. Dorsal divisions of the ventral rami of L2, L3, L4. Okay, dorsal division. Yes, very good, very good. It is formed by the dorsal division of the ventral rami of L2, L3, L4. Now, the femoral nerve lies in a groove. Which groove does it lie? Iliopsoas groove. Just remember this, and these are all very important points, very important options for the MCQ students. The femoral nerve lies in the iliopsoas groove. That's between the iliacus and the psoas major. There's a groove. If you just find that groove, you are going to get the femoral nerve in that groove. Now, the femoral nerve has a trunk. एक उसका main trunk होता है and two divisions. It has got a main trunk and it has got two divisions. So I make it like this for you. बस ये flow chart याद रखना. The entire concept is going to be clear. That's the trunk of the femoral nerve. That's the anterior and the posterior division. So it has got a trunk and two divisions, and this is divided by whom? मतलब ये जो trunk है ना, it is divided into an anterior and posterior division by an artery. It is divided by the lateral circumflex femoral artery. Lateral circumflex femoral artery. Okay, so who divides the femoral nerve into an anterior and posterior division, students? It's the lateral circumflex femoral artery. Just remember that. So these are all very important points about the femoral nerve. It's a branch of lumbar plexus. Uska root value is the dorsal divisions of the ventral rami of L2, L3, L4. Then it lies in the iliopsoas groove. It has got a main trunk and is divided into an anterior and posterior divisions by whom? By the lateral circumflex femoral artery. Yes. So that's the trunk of femoral nerve. Let me tell you like this. That's the trunk of the femoral nerve. This would be the anterior division and ye hoga the posterior division. Right. So now you tell me, what are the branches from the trunk of the femoral nerve? From the trunk is nerve to iliacus. Nerve to iliacus, and the second one is nerve to pectineus. This is the easiest way, students, to understand the femoral nerve. So nerve to iliacus and nerve to pectineus. वो भी कौन सा half? It's the lateral half of pectineus. So from the trunk you get two branches. One is the nerve to iliacus. The second one is the nerve to pectineus. Anterior division gives one muscular branch and two cutaneous branches. One muscular, two cutaneous. One muscular branch is given to sartorius, and two cutaneous branches, that is the anterior and the medial, femoral cutaneous nerves of thigh. Anterior and the medial femoral cutaneous nerves of thigh. This is very specific, students. Remember, anterior and medial femoral cutaneous nerve of thighs are branches of what? Femoral nerve. Whereas lateral femoral cutaneous nerve of thigh, anyone, is a branch of what? Branch of lumbar plexus. It's a direct branch of lumbar plexus. Remember, students, the lateral femoral cutaneous nerve of the thigh is a direct branch of lumbar plexus, whereas the anterior and the medial femoral cutaneous nerve of thighs are branches of anterior division of femoral nerve. This is extremely important. Why is this lateral femoral cutaneous nerve of thigh so important? It's a branch of lumbar plexus, and this is the nerve which comes at the most lateral aspect of the inguinal ligament. Remember, students, this is a nerve जो सबसे lateral aspect पे आता है of the inguinal ligament. And this is the nerve which can get compressed against the inguinal ligament. When it gets compressed against the inguinal ligament, what does the person complain of? The person will complain of paresthesia, tingling and numbness along the lateral aspect of the thigh. And this is what we call as meralgia paresthetica. Meningia paresthetica. So meningia paresthetica is due to compression of which nerve? The lateral femoral cutaneous nerve of thigh. Okay, I'm there in between the. Okay, so that's meningia paresthetica. So posterior division. Now coming to the posterior division, students. Posterior division gives 4 muscular branches and 1 cutaneous branch. 4 muscular branches to quadriceps femoris. Quadriceps femoris, 4 है ना अपने पास, 4 quadriceps है. 1 is the rectus femoris and 3 vastus. Vastus lateralis, vastus intermedius and vastus medialis. So together 4 quadriceps. And 1 cutaneous branch. What is this nerve? Saphenous nerve. Saphenous nerve. The cutaneous branch is the saphenous nerve. Very important, very important. So this is a quick revision of the femoral nerve. That's how you are going to revise it. So that's how we revise the femoral nerve. Is this clear? If there's anything not clear, just let me know. So it has got a trunk and 2 divisions, anterior posterior branches from the trunk. 1 is the nerve to iliacus, second is nerve to pectineus. Anterior division gives 1 muscular, 2 cutaneous branches, muscular branch to sartorius, and cutaneous branch is the anterior and the medial femoral cutaneous nerves of thigh. Remember, the lateral femoral cutaneous nerve of thigh is not a branch of femoral nerve. It's a direct branch of lumbar plexus, and compression of this nerve against the inguinal ligament leads to meningia paresthetica. Posterior division gives 4 muscular, 1 cutaneous branch. 4 muscular branches are going to supply the quadriceps, and 1 cutaneous branch is the saphenous nerve. Now, what is the saphenous nerve supply? That you have to know. Supplies the medial aspect of the leg and the foot up to the great toe. ये जो saphenous nerve है ना, what does it supply? It supplies the medial aspect of the leg. I'll just mention this for you. Medial aspect of the leg and the foot up to great toe. Up to the great toe. Medial aspect of the leg and the foot up to the great toe. This is perfect, clear to all of you. Okay. Now understand one more thing about this saphenous nerve. One more thing. I'll just make the leg here. This is another very important options which comes in the MCQ, students. Yep. So that's the sole of the foot. Huh? Ye plantar aspect of the foot. Plantar aspect. This is the medial and this is lateral. So students, what I'm telling you is who's supplying the skin on the medial aspect of the foot up to the great toe. Medial aspect of the foot up to the great toe. This is the saphenous nerve. Saphenous nerve. So saphenous nerve is a branch of posterior division of femoral nerve. Posterior division of femoral nerve, it supplies the skin on the medial aspect of the leg and the foot up to the great toe. Up to the great toe. Now, who supplies the skin on the medial aspect of the great toe? Medial aspect of the great toe is supplied by superficial peroneal nerve. Medial aspect of the great toe ka skin is supplied by superficial peroneal nerve. All the web spaces, you understand web spaces? Yes. All the web spaces are supplied by superficial peroneal nerve. Superficial peroneal nerve. The first web space where we put our slippers, this one. So first web space, this is supplied by the deep peroneal nerve. Deep peroneal nerve. And the lateral aspect of the foot, the lateral aspect of the foot is supplied by sural nerve. Sural is a branch of tibial nerve. Lateral aspect of the foot is supplied by sural. Sural is a branch of tibial nerve. The heel is supplied by tibial nerve. Tibial. Yes, sole hai, plantar aspect hai, students. Don't forget. This is the plantar aspect. The heel is supplied by tibial nerve. 3.5 fingers on the medial aspect is supplied by medial plantar nerve. Medial plantar nerve. and 1.5 fingers is supplied by lateral plantar nerve. 3.5 fingers by medial plantar nerve and 1.5 fingers by the lateral plantar nerve. Remember students, the medial and lateral plantar both are branches of tibial nerve. ये याद रखना. The medial and lateral plantar both are branches of tibial nerve. That means the entire sole of the foot is supplied by whom? Tibial nerve. The entire sole of the foot is supplied by tibial nerve. Okay, this is sole, don't forget, this is not dorsal aspect, this is the sole of the foot, plantar aspect. So the entire sole of the foot is supplied by tibial nerve. I hope this is clear to all of you. Plenty of MCQs and plenty of options in the MCQs also you get on this. So once again, I'll just repeat, the medial aspect of the foot up to the great toe, saphenous. Medial aspect of the great toe, superficial peroneal. All the web spaces, superficial peroneal, except first web space, that's deep peroneal. The lateral aspect of the foot, sural nerve, it's a branch of tibial. The heel is supplied by tibial. 3.5 fingers, medial plantar, 1.5 lateral plantar. Both medial and plantar are branches of tibial nerve. Students, a very close resemblance, if you can get this, 3.5 fingers, something very similar. Can you correlate this? Something very similar to the hand, the palmar aspect of the hand. Yaad hai, ye 3.5 fingers on the palmar aspect is supplied by whom? Yes, 3.5 fingers on the palmar aspect is supplied by whom? Yes, very good. That's the medial nerve. Medial nerve. So medial nerve resembles to which nerve of the lower limb? Students, medial nerve resembles to which nerve of the lower limb? The medial plantar. Very good. And 1.5 fingers yahan pe, 1.5 fingers is supplied by whom? Ulnar nerve. Very nice. So 1.5. So the ulnar nerve resembles to which nerve of the lower limb? That's the lateral plantar nerve. Perfect. Medial nerve resembles to medial plantar. Ulnar nerve resembles to lateral plantar nerve. That's it. These are extremely important things. So I've told you everything here. So have a look. So a person was involved in a fight and the knife point hit the femoral nerve. So the femoral nerve is injured. Now see, all the following signs and symptoms are true except the right quadriceps femoris failed to contract. Students, the right quadriceps femoris failed to contract when the person was asked to extend the right knee joint. Correct? So the femoral nerve is going to supply the quadriceps femoris. So the quadriceps will be paralyzed. What is the action of quadriceps femoris on the knee joint? Extension. Quadriceps femoris kya karta hai? Extension at the knee joint. So this is correct. The right quadriceps femoris failed to contract when the patient was asked to extend the knee joint. Skin sensations were lost on the anterior and the medial aspect of the right thigh. Correct? Because who's going to supply this? The anterior and the medial femoral cutaneous nerves of thigh, and these are the branches of anterior division of femoral nerve. Skin sensations were lost on the medial border of the great toe. Students, medial border of the great toe. This is wrong because I told you the medial border of the great toe is supplied by whom? The superficial peroneal nerve. Yes, the medial border of the great toe is supplied by superficial. Up to the great toe, the medial border of the foot is supplied by whom? Saphenous nerve. Up to the great toe, saphenous. Great toe is superficial peroneal. Skin sensations are lost on the medial aspect of the right lower leg. Who's this? Saphenous nerve. That's correct. Saphenous nerve. That's correct. I hope this is clear to all of you, bachcho. So C is wrong. Any doubts? Children, any doubts you have? Yes, Emmanuel? Dr. Alika? Fine? Understanding? If you have any doubts, the rest of you also, please do ask. Concept has to be clear. Okay? Fine, we proceed then. We proceed to the next slide. Okay. Have a look. Go through it and answer. Answer. Students, what did you know? You answer. And need not retract the messages. This is what we are discussing. Okay, even if you make mistakes here, we are going to correct it. So don't worry about that. Anyone? So do I start with this MCQ? Any guesses? Anyone wants to answer this? You can answer. I'll start. A person meets with an accident. Fine. He has a fracture at the base of the skull. Agreed. Upon regaining consciousness in the hospital, he notices that he cannot move the muscles on the right side of his face, leading to drooling and a dry eye on that side. Means the person is not able to move the muscles on the right side of the face. Tell me, students, which is the nerve? Petrotympanic fissure. Bole Manoj? We'll see. Which is the nerve which is going to supply the muscles of the face? Anyone answer this? Don't retract the message, children. That's okay. Who's going to supply the muscles on the face? Can anyone answer this? Manoj has answered right now. It is facial nerve. Who's going to supply the muscles of the face? That's a facial nerve. The muscles of the face are derived from the second pharyngeal arch. And which is the nerve of the second pharyngeal arch? That's the facial nerve. So now we know the facial nerve is injured for sure. Facial nerve is injured because the person is not able to move the right side of his face, muscles on the right side of his face. So definitely facial nerve involvement है. अब वो facial nerve का involvement कहाँ है? That you have to understand. Correct? At what level is it? That you have to understand. So let us go further. As now when you're reading the MCQ, try to analyze it. And try to come to a differential diagnosis before you see the options. Right. Now, further testing by his neurologist indicates that the motor component of facial nerve on his right side is not functional. Motor component of the facial nerve on the right side. What is the motor component of the facial nerve supply? The muscles of second pharyngeal arch. It supplies the muscles of second pharyngeal arch. So, motor component is gone. Although lacrimal secretion, submandibular secretion and taste are all intact. Yes, are intact. This suggests that the nerve is severed as it passes through. Very good. Answer is stylomastoid foramen. Perfect. Answer is stylomastoid foramen. I'll tell you why. But if you can quickly tell me what comes out through the petrotympanic fissure. बोल सकते हैं कोई? Can anyone answer this? What gets out through the petrotympanic fissure? Students, come on. Petrotympanic fissure. This is the chorda tympani. The chorda tympani gets out through the petrotympanic fissure. The chorda tympani then goes and joins with what? Lingual nerve. It goes and joins with the lingual nerve. Foramen spinosum से what goes is the middle meningeal artery and nervus spinosus. Middle meningeal artery and nervus spinosus. What passes through the internal acoustic meatus? 7th nerve, 8th nerve and labyrinthine artery. 7th nerve, 8th nerve and labyrinthine artery. What passes through the internal acoustic meatus? That's the 7th nerve, 8th nerve and labyrinthine artery. Is this clear? Students, just a quick go through of the facial nerve. एक फटाफट facial nerve देखते हैं. Yes, very good, बच्चा, very good. We'll just go through the facial nerve. Whatever you know, you answer, students. Let us be very clear about the concepts. Now tell me, the facial nerve is going to supply the muscles of the second pharyngeal arch, correct? To supply the muscles of the second pharyngeal arch, what is that component which the facial nerve should have in its nucleus? Can anyone answer this? Facial nerve supplies the muscles of the second pharyngeal arch. To supply the muscles of second pharyngeal arch, वो कौन सा component है which the facial nerve should have in its nucleus? The name of the component is, anyone, can you answer this? This is special visceral efferent component. Special visceral efferent. And this special visceral efferent component is going to supply the muscles of second pharyngeal arch. What is the name of the nucleus of facial nerve belonging to this component? The name of the nucleus of facial nerve is motor nucleus of facial nerve. Motor nucleus of facial nerve. What else is the facial nerve supply? Facial nerve supplies all the glands of the head and neck. All the glands of the head and neck except parotid. Except parotid, it supplies all the glands of head and neck. Students, to supply the glands, what is the component that the facial nerve should have in its nucleus? General visceral efferent. To supply the glands, general visceral efferent. And what is the name of the nucleus of facial nerve which has this superior salivary nucleus? and lacrimatory nucleus. Superior salivary and the lacrimatory nucleus. What else is the facial nerve supply? The tongue. Facial nerve supplies the tongue. Anterior 2/3. So what is that? Functional component. Special visceral afferent. Special visceral afferent. And what is the name of the nucleus? Nucleus of tractus solitarius. Nucleus of tractus solitarius. Okay. The facial nerve also carries sensations from the ear. So that is general somatic afferents. That I'll tell you sometimes later. So just understand this much for now. So these are the components of the facial nerve. These are the nuclei of the facial nerve, and the facial nerve would be coming through all this nucleus. The fibers will be coming through all this nucleus. The facial nerve is now attached to the brainstem at the pontomedullary junction. The facial nerve is attached to the brainstem at the pontomedullary junction. The facial nerve now enters the internal acoustic meatus. The facial nerve enters the internal acoustic meatus. Now, when the facial nerve enters the internal acoustic meatus, it's inside the internal ear. It goes inside the internal ear. From the internal ear, the facial nerve now comes in the middle ear cavity. This is the medial wall of middle ear. What is this elevation here? That's the promontory. And on the promontory, what is this plexus, children? What is this plexus on the promontory? That's the tympanic plexus. Tympanic plexus. The facial nerve from the internal ear now comes into the middle ear cavity. It undergoes a bend. And what is this bend known as genu? The facial nerve now goes above the promontory. Now again undergoes a second bend, genu. Now goes behind the promontory, gets a foramen here. What's that? Stylomastoid foramen. It gets out through the stylomastoid foramen, enters the parotid gland. It now enters the parotid gland and now gives 5 branches. These 5 branches of facial nerve. Okay? 5 branches of facial nerve. So this is a course of facial nerve. Clear, no? Enters the internal acoustic meatus. From the internal acoustic meatus comes into the middle ear. Internal ear से middle ear में आता है. It undergoes a bend. We call this bend as the genu. Then it goes above the promontory. Then it again undergoes a bend, second bend. Then goes behind the promontory, gets out through the stylomastoid foramen, and enters the parotid gland. It gives 5 branches. In the ear, bachon, in the ear, the facial nerve gives 3 branches. 3 branches. 1. Anyone, can you answer this? What is this? Greater petrosal nerve. Greater superficial petrosal nerve or the greater petrosal nerve. What is this second nerve? This is the nerve 2. Stapedius, and the third one is chorda tympani. Chorda tympani. So greater petrosal nerve in sequence hai ye. Greater petrosal nerve, the nerve to stapedius, and chorda tympani. These are the 3 branches, and then it gets out through the stylomastoid foramen and gives this 5 branches. Tell me, what is this nerve to stapedius supply? The stapedius. And what is the action of stapedius? It dampens the sound waves. It reduces the sound decibels before it comes to the ear. And if this stapedius is damaged, what does the person get? A hyperacusis. Hyperacusis. Okay. What does the chorda tympani nerve carry? The chorda tympani nerve carries 2 things. One is taste sensation. I'll just write this down for you. Taste sensation. So this becomes very easy. Taste sensations from anterior 2/3 of the tongue, anterior 2/3 of the tongue, and the chorda tympani also carries secretomotor fibers, to submandibular and sublingual glands. Submandibular and sublingual glands. बस ये याद रखना, ये ना ये flow chart याद रखना. The entire facial nerve will be easy for you. So if you understand, if the chorda tympani nerve is injured, students, if sole injury of chorda tympani होता है, infratemporal fossa में आ गया chorda tympani joins with the lingual, अगर chorda tympani nerve injure होता है in the infratemporal fossa, what will the person complain of? The person will complain of loss of taste sensations from the anterior 2/3 of the tongue. Secondly, the person will also complain of loss of secretions to the submandibular and the sublingual salivary glands. Perfect. Perfect. This should be. Huh? Okay, great. If the nerve to stapedius is gone, what will the person complain of? Hyperacusis. Hyperacusis. And what is this greater petrosal nerve supply? The greater petrosal nerve is going to supply the lacrimal. मतलब greater petrosal joins with deep petrosal forms the nerve pterygoid canal. वो उसका पूरा pathway है. But finally, what does it supply? Lacrimal, nasal, palatine, and pharyngeal glands. Lacrimal, nasal, palatine, and pharyngeal glands. Look, this is so nice, students. Understand this pathway, understand the slide which I have drawn for you. A beautiful slide. So it's so nice. Okay, I'll start now. Okay? Understand the lesions now. Now, what I'm telling you, the facial nerve is injured here. देखो, the facial nerve is injured at the stylomastoid foramen. ये stylomastoid foramen है. The facial nerve, what fibers is it carrying? As it emerges out of the stylomastoid foramen, it is only the fibers which are supplying the muscles. Which component is that? Special visceral efferent. मतलब जब ये facial nerve stylomastoid foramen से emerge होता है, what is the component which is left with the facial nerve? Are you following this, बच्चों? As the facial nerve gets out through the stylomastoid foramen, which is that component left with it? Special visceral efferent. And this component is only going to supply the muscles of pharyngeal arches. And yes, that's why the facial nerve, when it enters the parotid gland, it divides into 5 branches and supplies the muscles of facial expression. Okay. So if the facial nerve is injured at the stylomastoid foramen, what does the person get? The person gets a ipsilateral paralysis of the entire face. Half of the face is gone. This is what we call as Bell's palsy. Bell's palsy. So if the facial nerve is injured at the stylomastoid foramen, the person gets a Bell's palsy. Now, if the injury is here, if this is the second injury, above the chordae tympani, facial nerve is injured above the chordae tympani. So, एक तो Bell's palsy तो होगा ही. Bell's palsy is already there. In addition, what will the person complain of? Loss of taste sensations from the anterior 2/3 of the tongue, loss of secretions from the submandibular and the sublingual glands. Following? थोड़ा सा ऊपर lesion है, थोड़ा सा ऊपर. In addition to all this, the person will have hyperacusis. And if there's a lesion here, that's number 3. And if there's a lesion here, just after the genu, if there's a lesion here, just before the greater petrosal nerve, now, the person will complain of loss of secretions from all the glands except parotid. Loss of secretions from all the glands except parotid, because parotid is supplied by a different nerve. Can you tell me, students, which is the cranial nerve supplying the parotid gland? Cranial nerve supplying the parotid. Yes, you got it right. That's the glossopharyngeal nerve. Perfect. That's the glossopharyngeal nerve. So what is the cranial nerve supplying the parotid? The glossopharyngeal. And what is the name of the nucleus of the glossopharyngeal nerve to supply the parotid? Inferior salivatory nucleus. Yes, that's the name of the nucleus of facial nerve, glossopharyngeal nerve to supply the parotid. Inferior salivatory nucleus. And what is the name of the nucleus of facial nerve to supply the rest of the glands? Superior salivatory and lacrimatory nucleus. Perfect, students. Perfect. So, one more thing I'll tell you, taking the advantage of this MCQ, when there's a lesion of facial nerve above the genu, यहाँ पे, when there's a lesion of facial nerve here, when there's a regeneration going on, the fibers going to the lacrimal gland, look specific है, the fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular and the sublingual gland. There's a mixing of fibers. When there's a lesion of facial nerve above the geniculate ganglion, high lesions of facial nerve, when there's a regeneration going on, the fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular and sublingual gland. Now what happens? When a person salivates, the person starts to get tears. This is what we call as crocodile tears. Perfect. So crocodile tears involve which 2 glands? The lacrimal and the submandibular glands. Crocodile tears involve the lacrimal and the submandibular glands. So that's it. I've told you the entire facial nerve in short. Okay, fine students. Just identify this visual slide. Just identify this pointed structure. You can see that very clearly. I need not magnify it. Chalo bachcho, answer this. What do you think is this? Don't read anything, huh? Don't read anything. I'll just dump all these things for you. I'll just clear all these things for you. Answer this. This is the vagus nerve. That's very evident, vagus nerve, because it is lying inside the carotid sheath. Okay, anyway, I'll magnify this for you, children. Okay, look at this, beautiful. That's the vagus nerve. Yes, you got it right. That's the vagus nerve. What you're thinking was perfect. Vagus nerve would lie between this nerve, this vein. That's the internal jugular vein. That's the internal carotid artery. That's the vagus nerve. Together put in a sheath, which is known as carotid sheath. Put in a sheath. That's carotid sheath. And students, who lies on the anterior wall of the carotid sheath? A loop. What is the name of the loop? Ansa. Found in the neck. Ansa cervicalis. Correct. Ansa cervicalis is the name of the loop. Ansa cervicalis. Clear? That's right. Yes, you can actually see that. Yeah. You can actually see that loop. Beautiful loop. That's the ansa cervicalis. That's ansa. What is this nerve here? That's the posterior triangle of the neck. And what is the nerve which lies in the posterior triangle of the neck? That's the spinal accessory nerve. Yeah, spinal accessory nerve. And what is this bunch of nerves that you get here? A plexus. That's the brachial plexus. Brachial plexus. Along with the brachial plexus, you get this artery here. Name. That's the subclavian artery. Subclavian artery and the brachial plexus. If that's the brachial plexus and subclavian artery, what is this muscle going to be? Scalenus anterior. That's the scalenus anterior. And behind the scalenus anterior, this muscle would be the scalenus medius. Scalenus medius. So the brachial plexus and the subclavian artery lies between which two muscles in the neck, students? The scalenus anterior and the scalenus medius. समझ में आ रही है? Look, that's the scalenus anterior, that's the scalenus medius, that's the brachial plexus and the subclavian artery. Perfect, lies between the scalenus anterior and the medius. And what's this? This is the subclavian vein. Subclavian vein. And this is the subclavian artery. So who separates the subclavian vein from the subclavian artery? The scalenus anterior. Scalenus anterior is going to separate the subclavian vein from the subclavian artery. Vein from the artery. Okay, fine, perfect. We go to this. Next MCQ. Answer this. Come on, students, come on. Anyone? Answer this. A chronic alcoholic was diagnosed with a pseudocyst of pancreas. The pancreas is a retroperitoneal organ. That's correct. Pancreas is a retroperitoneal organ. Students, can you tell me which are the other retroperitoneal organs? एक तो pancreas यहीं पे लिखा ही है. Pancreas is a retroperitoneal organ. Any other retroperitoneal organs do you know of? This is extremely important and this you should know. This you have to know. Come on, just tell me quickly the list of retroperitoneal organs. One are the kidneys. Ureters, suprarenal. Yes, very good, Dr. Alka. Kidneys, ureters, suprarenal, pancreas, duodenum. Except, there's some exception for the duodenum. Not that the entire duodenum is retroperitoneal. No. The duodenum, yes, is retroperitoneal except a small area of the first and the fourth parts. A small area of the first and the fourth part is inside the peritoneum. We call this as intraperitoneal, small area. ascending and descending colon, aorta and IVC. So just remember this. This is the list of retroperitoneal organs. Plenty of MCQs you get, huh? Retroperitoneal abscess, retroperitoneal hematoma, something like that. So you have to know this. So kidneys, the suprarenals, the ureters, the duodenum, except a small area of the first and the fourth parts, the pancreas, ascending and descending colon, aorta and IVC. This is perfect, students. So this is the list of retroperitoneal organs. We come back to our MCQ. Yep. So a chronic alcoholic was diagnosed with pseudocyst of pancreas. The pancreas is a retroperitoneal organ. All the following statements about pancreas are true except tail contains the maximum islets of Langerhans. What do you say, students? Come on, answer. Yes, the maximum islets of Langerhans are present in the tail of the pancreas. Correct. And the tail of the pancreas lies in which ligament? Tail of the pancreas lies into which ligament? The linorenal ligament. Correct. The tail of the pancreas lies in the linorenal ligament. And when we are doing a splenectomy, when you are removing the spleen, if you are removing the spleen, you have to cut those two ligaments of the spleen. The one in front, what's that? The gastrosplenic, and the one behind, that's the linorenal ligament. Only then you free the spleen. So when we are cutting the linorenal ligament, you have to be very, very, very careful, because that contains the tail of the pancreas. It contains the tail of the pancreas, and the maximum islets are present in the tail of the pancreas. So that's it. If the tail is gone, the person will land in diabetes mellitus. So yes, the tail contains maximum islets. Correct. C of the pancreas is more common in which part? Cancer. Carcinoma of the pancreas is very common in the head. Very good, you got this right. So CA is very common in the head of the pancreas, and when there's a CA of the head of the pancreas, who's compressed? Who's behind the head of the pancreas? The bile duct. And the person gets an obstructive jaundice. Right? So behind the head of the pancreas is the bile duct. Cancer compresses the bile duct. The person gets an obstructive jaundice. Coming to the next. The left crus of the diaphragm is related posteriorly to the body. Yes, correct. The left crus is related posteriorly to the body. Which are the other posterior relations of the body of the pancreas? Okay, posterior relations of the bodies. I'll just write this down for you. Aorta, you can see this, no? Aorta with, I'll write it here only, with origin of superior mesenteric artery. I'm telling you the posterior relations of the body of pancreas, bacho. Posterior relation, extremely important, very, very important. So posterior relations of the body of the pancreas is 1. Aorta with the origin of superior mesenteric artery, left renal vein, left crus of the diaphragm, left renal vein, left crus of the diaphragm, left kidney, left suprarenal and splenic vein. So these are the posterior relations of the body of the pancreas. Very important, student. This slide I'll show you somewhere else. So posterior relations of the body of the pancreas. 1 is the aorta. Yes, sequence here. We're going from the right to the left. So aorta with the origin of superior mesenteric artery, the left renal vein, the left crus of the diaphragm, the left kidney, the left suprarenal gland, and the splenic vein. Okay. Options D. Splenic artery supplies the pancreas. Correct. Splenic artery runs on the superior border of the body of the pancreas. The splenic artery runs on the superior border of the body of the pancreas, and it gives branches to the pancreas. Right now, you know this? You can see, what I have written. So splenic artery runs on the body of the pancreas, gives branches to the pancreas, and this is what we call as the pancreatic branches. Unsafe pus drains via the accessory pancreatic duct into the duodenum. That's wrong. The uncinate process drains via the main pancreatic duct. Main pancreatic duct. I'll just draw this for you. Uncinate process drains via the main pancreatic duct. Have a look. Have a look at the screen. Now, students, this is the pancreas, and that's the uncinate process of pancreas. Uncinate process. So, this is the duct of the dorsal bud. This is the duct of the dorsal bud, and this is the duct of the ventral bud. Duct of the dorsal bud and duct of the ventral bud. And that's the second part of the duodenum. That's the second part of the duodenum. Okay, so that's the duct of dorsal bud, that's the duct of ventral bud. So, एक मिनट. How does the pancreas form? The pancreas is derived from two buds, the dorsal pancreatic bud and the ventral pancreatic bud. ये आपको पता है ना? What is the dorsal bud form? Okay, I'll just mention this for you. The dorsal pancreatic bud. The dorsal pancreatic bud forms what? Upper part of the head. This is very important. Upper part of the head. Upper part of the head, neck, body, and tail of the pancreas. Okay, so the dorsal pancreatic bud is going to form the upper part of the head, neck, body, and tail of the pancreas. Ventral pancreatic bud forms the lower part of the head, and uncinate process. This you should know. This you have to know. Okay. So lower part of the head and the uncinate process. Clear? So now students, this is the duct of the dorsal bud and this is the duct of ventral bud. The duct of dorsal bud, the duct of ventral bud. So how's the main pancreatic duct formed? The main pancreatic duct is derived from the duct of the dorsal bud, the duct of the dorsal bud, the duct of the ventral bud, and anastomosis between them. So the main pancreatic duct is derived from the duct of the dorsal bud. I'll just write it like this: duct of the dorsal bud, duct of the ventral bud, and the anastomosis between them. This becomes the main pancreatic duct. Main pancreatic duct, it is also known as the duct of Wirsung. Duct of Wirsung. Okay. So the main pancreatic duct is known as the duct of Wirsung, and where does it open? It opens at the major duodenal papillae. Yes, it opens at the major duodenal papillae. How many centimeters is this from the pylorus? 8 to 10 centimeters from the pylorus. 8 to 10 centimeters from the pylorus. And what is this going to form now? This is going to form the accessory pancreatic duct. Accessory. This is going to form the accessory pancreatic duct. Or that is also known as the duct of Santorini. So duct of Santorini, it is formed by the main pancreatic duct. Okay, it is formed by the main pancreatic duct, and where does it open into? It opens in the minor duodenal papillae. Yeah, यहाँ पे होगा minor duodenal papillae. How many centimeters is this from the pylorus, students? 6 to 8 centimeters from the pylorus. Yes, 6 to 8 centimeters from the pylorus. Is this clear to all of you? Perfect. This is very important MCQ. The main pancreatic duct and the accessory pancreatic duct. So once again I'll repeat, the main pancreatic duct is derived from the duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. It's a zigzag. The main pancreatic duct, also known as the duct of Wirsung, opens at the major duodenal papillae 8 to 10 centimeters from the pylorus. And there's an accessory pancreatic duct which is derived from the duct of the dorsal bud, also known as duct of Santorini, opens at the minor duodenal papillae 6 to 8 centimeters from the pylorus. And then I've told you what is the dorsal bud form, what is the ventral bud form. Normally क्या होता है ना, this ventral bud, if I just make it like this here for you, that's the duodenum, that's a dorsal pancreatic bud, and who's this ventral pancreatic bud? हाँ, ये dorsal है, ये ventral pancreatic bud है, and this dorsal pancreatic bud will migrate from behind, ये पीछे से जाएगा, and then it will come and join with the dorsal bud. The ventral bud normally migrates from behind and goes and joins with the dorsal bud. But sometimes half of the ventral bud goes from back, half of the ventral bud comes from front, and such a type of pancreas is going to encircle the duodenum. What do we call this pancreas as? The annular pancreas. Annular pancreas. So annular pancreas, students, occurs due to defective migration of the ventral pancreatic bud. Defective migration of ventral pancreatic bud. वैसे एक ही bud migrate होता है, remember. Sometimes the ventral bud does not fuse with the dorsal bud. ये fuse नहीं होते. In this case, you get a divided pancreas. This is what we call as pancreatic divisum. So pancreatic divisum occurs due to non-fusion of the two pancreatic buds. Non-fusion of the two pancreatic buds results in pancreatic divisum. Okay, clear to all of you? So that's about the MCQ. Okay, before I begin, I'll just brief you about our platform. Students, look at this now. We have got a plus subscription in which there are daily live classes, live quizzes, study from the device of your choice, learn from the top educator, and now you can access to our 25,000 plus MCQs from the bank. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features in which there are daily live classes, live polls, raise a hand technique. Never miss a class with proper notifications being given. Okay, lecture notes. Suppose in case if you miss the class, you get lecture notes in the form of PDF. You get recorded lectures, and anytime, anywhere you can access the class and get your doubts solved. A highly effective and updated question bank has been prepared specially for you students with some 25,000 plus MCQs with detailed explanatory answers. These are our students in the last NEET PG exams. They have got very good ranks. We congratulate once again. Raise a hand technique in which if you press the icon, you can directly talk to the educator. Now students, Unacademy has come with some free test for all the students across. There are this we call as rituals. We call this as rituals because they are on the same day, same time. So this you will register in your brain. You'll never forget this. This is rituals. So now we've got a subject-wise test series, educated curated test series, which is on Wednesday 9 p.m. To give this test, students, we've got FMG Grand Test on Wednesday 9 a.m. and 2 p.m. We've got Study With Me YouTube Test Series on Friday 9 p.m. Okay, special marathon class-based test series on Saturday 9 p.m. And now we've got a grand test for all our courses across on Sunday at 9 a.m. Okay, so these are free tests. Do give this test. Students, we are starting with 2 new batches of FMG 2022 comprehensive batch and target NEET PG 2022 MCQ discussion batch from 22nd of November. And students, the NEET PG compact is here for you once again, with a lot of prizes to be won, free subscriptions for you. Remember the date, 19th of December, time 5 p.m, 45 questions in 1 hour, 60 minutes. Okay, so do give this test, spread this word, spread this to your friends. Let them also get involved. You can get a free subscription. You can get many scholarships. So remember the date, 19 December, 5 p.m, 45 MCQs, 60 minutes. Download the Unacademy app and subscribe to it. Any doubts you have, students, in this, you tell me. Now we'll be taking us tomorrow once again. I'll be taking a lecture same at 10 o'clock. Okay, so we'll be taking a lecture also tomorrow, also solving some MCQs once again. I hope everything is clear to all of you, and if you have any doubts, you can tell me. You can ask me any doubts. Yes, students, any doubts? So thank you for this patient listening, and we'll meet once again tomorrow with a new set of MCQs. Thank you. Thank you to all of you. Okay. Thank you. Bye-bye.